So welcome to our first breast cancer survivorship event. And today we're going to be talking about skin, hair, and beauty. This is a monthly virtual series that we are really doing a deep dive into a lot of the topics that breast cancer survivors and thrivers struggle with, and that they're not able to kind of get into these topics in the office so much when we have shorter visits. So I hope that this is a really helpful session for you, and that's something that you can come back to and listen whenever is convenient, and kind of if you want to reference something and come back to it. You can follow me on Instagram at Dr. Duplinski. You can follow the Valley Hospital at Valley Breast Center. We do a lot of great content on there as well. So with that, kind of let's get right into today's talk. So today I'm going to talk about skincare during chemotherapy and during cancer treatment. We're going to talk about hair, supplements after chemo, dyes, what to do for hair thinning, how to take care of your scalp during chemo, skin and beauty and makeup. So lots of topics to discuss. So let's quickly start by talking about the changes that we experience during chemotherapy. So during chemotherapy, our skin can become dry, it can become itchy, red, darker, it can peel. And some people do develop photosensitivity, meaning that they rash or they sunburn easily. So maybe they're not used to it. Normally the sun doesn't bother them, and now they are on chemo and they find that they burn or get sensitive much more easily. People can experience skin pigmentation changes. Their skin can become darker, acne type rashes, and the skin changes are different depending on the drug that's used. The other thing we don't talk about a lot is nails, and the things we don't talk about is nails, and nails may get dark, they can get cracked, or cuticles may hurt, and that actually sometimes mimics neuropathy, which is numbness or tingling that can happen with certain chemotherapy. But if you have a lot of pain or discomfort, it can be hard sometimes to differentiate between what is the nail changes from the chemo versus actual neuropathy. And important point is that it's not just chemotherapy, so it may include treatments such as anti-HER2 therapy like trastuzumab and Perjeta, Perjeta is very known for causing rashes. So these are just some examples of skin changes that may occur. So over here, you will see on the top left, this is an example of hand and foot syndrome, which we see in things like Xylota. We can see that in Doxil. And it's really important to kind of care for that. So that becomes really important here. On the bottom left, you can have changes in the nails. So you can see they get darker, they get kind of ridgy over here. So that's very common. In the middle, this is something that we see either with chemotherapy or with Perjeta. And it kind of gets that acne-like appearance. And then on the top right is the hyperpigmentation that we can see. And so you can get kind of a variety of all of these pictures. Now, if you just joined, I'm actually re-recording this session because my part didn't record. So the talk is over. You're more than welcome to stay on and listen, but I'm just re-recording this for everybody for the future. So talking about skincare during chemotherapy, and then we'll talk about what to do after. So during chemotherapy, we want to make sure that we're cleaning the skin gently with warm water, gentle soap, a soft cloth, rinsing that area carefully, especially if that area is affected by a rash, and really patting dry rather than rubbing, especially if you have that irritated hands and feet. The face, you don't want to rub very because that can irritate it further. If you're washing the dishes, I always recommend using rubber gloves, things like that, and avoiding really hot or really cold temperatures. Avoiding products that contain alcohol and using unscented varieties when you can, using gentle creams or lotions to moisturize the skin, and using that moisturizer ideally after the shower, so it kind of traps in all that moisture. Sunlight, as we talked about, can trigger or worsen rashes, so sunscreen is really, really important. We want to use an SPF of at least 30, and really making sure you're using a broad spectrum mineral sunscreen. So that is zinc oxide or titanium dioxide. Those should be the ingredients. The sunscreens that a lot of us grew up with are the avobenzones or anything with benzone in it, and that has recently in the last few years come out as being carcinogenic. So we want to really focus on a mineral sunscreen. And one of the things we forget to talk about a lot is our lips. Our lips can get chapped, they can get dry, they can crack, they can get irritated. So making sure that you have a good lip balm, one with antioxidants, vitamin A, C, and E, and that's something that tends to get overlooked a lot, but super, super important. So what to avoid or limit during chemotherapy. So drying ingredients, those we want to stay away from, things that have parabens, sodium lauryl sulfate, that can all irritate the skin. We want to pick sulfate-free formulas, and I'll show you how to search for those, especially for a cleanser. You want things that have high amounts of moisturizing ingredients such as glycerin or hyaluronic acid. Perfumes and fragrances can be quite irritating. And really stop exfoliating during chemotherapy, avoiding scrubs, alpha hydroxyl acid, retinol, glycolic acid. All of these can cause irritation. So very often people will think, oh, exfoliating is good. I want to clean the dead skin and all of that. But actually, not only can that irritate the skin, it can lead to a broken skin barrier. So that's not great because that can risk infection, cuts, and things like that. So here are some examples. So how do you know, and I never know always too, like off the top of my head, what's a good product or not. So the website that I really love is the Environmental Working Group, or EWG, their Skin Deep database, publicly available, free to use, and they rate their products. So the products that they think are the best in terms of toxins are going to be EWG verified. And then the rest of them, they rate from 1 to 10, 1 being, okay, as close to EWG verified as you can get, 10 being the worst. Okay, so we've got a whole variety. And I wanted to just look for things that we typically use and see how they were rated. So for example, on the top is Neutrogena Pore Refining Moisturizer. I'll be honest, I would have thought a couple years ago, Neutrogena is great. A lot of us use Neutrogena. I grew up putting that on my skin, and it's rated as an 8, which is really not great. And you can look at all these ingredients. So just like when we think about reading food labels, the more the worse. Same thing with skin. If you've got a ton of ingredients, probably not the best compared to something else. And you can see here that this contains parabens. It contains some alcohols, which again, we definitely don't want to do during chemotherapy because it can be irritating. Some fragrances. And even if you're like, I don't know how to read this label, and I wouldn't expect you to because I don't know how to read it either. What they do for each product is they tell you what they're concerned about with the ingredients. So in this case, they'll tell you what are they worried about in terms of cancer risk, allergy and immunogenicity, developmental and reproductive toxicity. So I think if people are trying to conceive, that is a concern, and other like use restrictions, kind of other things. So the two that we're really going to look at is going to be cancer and then allergies and immunotoxicity. And so you can see here that the Neutrogena is kind of a moderate risk for cancer because it has some of those parabens and things like that. But it also it can be really high risk for allergies. And so that's something that during chemo probably going to limit our use. On the bottom, you've got Aveeno. So daily moisturizing body lotion. We also think this is good. Right away, it tells you that it's fragrance free. So that's a plus. This has a lot less ingredients, although it still does contain some alcohols in it, but a lot less ingredients. And so you can see here in terms of how it scores for common concerns, it's low for cancer, which is great, but it's still going to be high for allergies and immunotoxicity. So, if you start using it thinking this is great on my skin and you start to have breakouts or irritations, then maybe kind of coming back and looking at that and saying, you know what, it really scores high for allergic things. Let me find something that's low on that list. And they've got a ton, they have thousands of ones. So I think it's a really great database to look at. And, I don't recommend kind of getting rid of all your products and throwing everything out and starting new. But, when you run out of something, I think it's a great way to replenish. And obviously, if you're on chemotherapy, you do want to be really clear about what you're putting on your skin. So let's talk about hair. So if you've lost your hair on chemotherapy, we do really recommend gentle shampoos or conditioner. I love to recommend a baby shampoo. I think that works remarkably well. You want to avoid ingredients such as salicylic acid, menthol, camphor, eucalyptus, henna, and sometimes we'll think eucalyptus, that sounds so soothing, but actually on the scalp, it could be really irritating. Scalp cooling is going to be an option for some patients on chemotherapy, depending on the regimen, depending on their preference. And so if you are scalp cooling or cold capping, that they're going to have a whole set of recommendations for you about how to take care of your hair and your scalp while on treatment. Don't forget to moisturize the scalp. It's really, really important. And sunscreen, and wear a hat. If you are going out without a head covering or a wig, your scalp is vulnerable, it is exposed, and so the last thing you want to do is get a sunburn, wind burn on your scalp. It is not fun, it's not safe. So I really like to point out the chemo curl. So the key is, and I try to tell patients, is that when you lose your hair during chemo and when it grows back, it can look different. It can have a different color, it can have a different texture, and it can have these curls that are very like short and bouncy kind of that we see here in the picture. And that's not forever. We can't predict who's going to get that and who's not, but usually when the hair grows out again, some of those chemo curls start to lessen, and we see people kind of regain some of their original texture. In terms of dyeing your hair after chemo, so a question that comes up a lot, when can I safely dye it? So about 6 months, in some cases 4 months is okay. A lot of it depends on how much hair you have. So, if you do it too soon and you only have an inch of hair, what happens is that it's going to damage the hair due to the chemicals in the products, because even the cleanest dyes have chemicals. And so we want to make sure that we're giving enough time. We also don't want to irritate the scalp if your hair hasn't really grown back yet. The scalp is drier, itchier than normal. So again, products may make it worse. So I know sometimes there's this like push to dye your hair as quickly as you can, but waiting actually can be better in terms of long-term benefit. When we are dyeing our hair, we recommend hair dyes that are free of kind of most of these following chemicals. So that's ammonia, PPD, PTD, hydrogen peroxide, lead. Obviously, those are parabens, like things that we don't want in our hair. And some people do recommend a henna dye, which is gentler and really works quite well. What about permanent or semi-permanent hair dyes? So there's 3 categories of dyes. There's temporary, semi-permanent, and permanent. So temporary, it covers the surface of the hair, but it doesn't penetrate into the hair shaft. So that's like your teenager dyeing her hair purple, for a party or whatever. But generally, they last for 1 to 2 washings, and then they wash out. Semi-permanent, those dyes do penetrate into the hair shaft, but they only last for about 5 to 10 washings, so not too long. And then we have the permanent or the oxidative hair dyes. And these cause lasting chemical changes in the hair shaft, and they are the most popular. Why? Because they last for a long time. The color changes last until the hair is replaced by new growth. So people don't want to dye their hair every 2 to 3 weeks, so they opt for the permanent dye. But these dyes contain a lot of chemicals, and they have these colorless substances that go through chemical reactions to become dyes. And darker hair dyes obviously use more of these coloring agents. So we can build up toxins and chemicals that way. So let's talk about the sister study. The sister study is a participant population of almost 47,000 women, and they enrolled them between 2003 to 2009, ages 35 to 74, and they have generated, just tons of research and data from this population. In this particular cohort, they included patients that had a sister with breast cancer, but the participants were they did not have breast cancer, so just the family history. And what they looked at was, how much dyes were they using? And again, looking at this because hair dyes and hair products contain endocrine disrupting chemicals and carcinogens. And what they found was that permanent dye was associated with a 45% higher risk in Black women and a 7% higher risk in white women. And so that's not to say that you should stop using permanent hair dyes. That's not. But what it is to say is that I think it's really important to know where your risk is, and figuring out how you balance it. So for some people, they're like, nope, I'm not going to use a semi-permanent dye. I'm going to use a permanent dye. My hair came back gray, and that's it. And I'm willing to accept this risk, whereas other people don't want to accept that risk. So everything is a risk benefit, but I think just being empowered and knowing, are you putting yourself at higher risk is important. So what are endocrine disruptors? So endocrine disruptors are chemicals that mimic or interfere with our hormones or our endocrine system, and they can affect development, reproduction, immune and nervous system, and cancer risk. So obviously really important for us. Common endocrine disruptors, and this is not just in skin and makeup, because BPA is a common disruptor, and we obviously you have those containers that say BPA free and cans and things like that. So BPA, phthalates, dioxin, PFCs, parabens. The list is super extensive, but they can play roles in all of these things. Now, turning our attention to chemical straighteners. So there's been a lot of press in the last few weeks about chemical straighteners, including increasing uterine or endometrial cancer risk. Now, I want to be clear, this is not like a straightener that you buy at home and run through your hair a couple of times to straighten it. This is that chemical treatment that you go to the salon maybe, but it's your permanently or semi-permanently straightening or relaxing your hair. So this isn't lasting for more than a day. These increase breast cancer risk by about 18% compared to people who don't use them. And the more you use them, the higher the risk. This risk did not vary by race. And then again, they used that same population for the sisters from the sister study, and they looked at almost 34,000 participants who had a uterus at enrollment. And that showed an 80% higher risk of uterine cancer among women who used a straightener in the past 12 months. And the risk was highest when you use it 4 times per year compared to people who did not use it. And so again, it goes to show you that just understanding what your risk is and figuring out how to modify that. Can I take a supplement to help my hair regrow or deal with thinning? A lot of people want to take a supplement. I understand you're impatient, you want your hair to grow back faster, or it's thinning on tamoxifen, you're a aromatase inhibitor, and you want to do something. Supplements can help. When we're thinking about helping with hair regrowth, a lot of those supplements take 3 to 4 months to work, by which point your hair is regrowing anyway. So some of it is, I will say, a placebo effect. But things like biotin, collagen peptides, there is very weak data for this, but they're okay to use. Nutrafol, fine. It has some proprietary ingredients, which I'll show, which you want to be careful of on tamoxifen. Rogaine. So all of those things, there's a ton. There's Vegamore. I mean, there's so many different supplements. I think just knowing within them and talking to your oncologist about them is important. But don't forget, hair thins or slows down regrowth for other reasons. Iron deficiency, stress, poor sleep, poor nutrition. So all of those things we want to evaluate, and COVID infection. Most of us have had COVID in the last few years, and COVID increases hair thinning and hair loss, and it not right away. Like, people are noticing it months after the fact. So just an important point to point out that while the medications are contributing, sometimes they're not 100% the culprit. So let's talk about Nutrafol, a very expensive supplement, works for some people. What's in it? Vitamin A, C, D, and E, which you can get in your multivitamin. Biotin, iodine, zinc, selenium. So all of these things, it's got a lot of biotin in it, but it's really biotin with a multi. Then they add to it their own proprietary blends, and you can see what they've got: collagen in here, they've got curcumin, they've got hyaluronic acid, a bunch of stuff. And so my concern with this, and they have never been, I've asked them and I've not gotten a straight answer, is how much curcumin is in there, because we know curcumin is an ingredient in turmeric, and that interferes with the efficacy of tamoxifen. So personally, I do not recommend patients take turmeric supplements. While on tamoxifen, you can certainly cook with it, but we don't want to take the supplement. So for my patients on tamoxifen, I try to stay away from Nutrafol unless you're going to use it just for a very short period of time. So what about deodorant and antiperspirant use? So there is no data, no scientific evidence that links deodorant or underarm antiperspirant use to the development of breast cancer. Where this comes from is that antiperspirants are designed to help us stop perspiring. And the way they do that is through aluminum, which forms a plug within the sweat duct, and it blocks the sweat from going to the surface of the skin. And so some studies have shown that aluminum has been measured at higher levels in human breast structures, but we actually don't know that this is significant in terms of inflammation or cell damage, changing the breast microenvironment. With that said, some people choose to use an aluminum-free and paraben-free product, and I think that's fine. There's so many out there, but if you stop using deodorant with aluminum, you're losing the antiperspirant. Number one, you're going to have changes in your underarm bacteria with sometimes increased odor, but also you won't stop sweating because you're losing that antiperspiration effect, but it will prevent odor. So a lot of times what people like to do is during the summer months, if they're sweaty a lot, it's really hot, they will use the antiperspirant and then they'll switch to something aluminum free for the winter. So, you got to figure out what you're comfortable with. The one thing I don't recommend is any spray antiperspirants, because those have been recently, some of them have been recently recalled due to benzene, which is a carcinogen. So in general, spray things, like they just recalled dry shampoo. So spray things tend to have more toxins. So you want to do like the stick or the roll on, it's going to be a little safer. Okay, Botox and dermal fillers. So common question. Dermal fillers are used to smooth fine lines and wrinkles and replace some of that volume loss that happens as we age. And then Botox blocks nerve signals, and so it allows muscles to relax, reducing wrinkles. Treatments are temporary, so obviously you have to keep doing them. And in general, no risk with cancer. So fine to do. But I don't recommend ideally during chemo because you are immunosuppressed. Any like injection can break the skin, higher risk for infection, allergies, irritability. So we do want to ideally save it for when someone is done with chemotherapy. Proper technique is important, so don't do it yourself. Go to someone reputable, but don't feel guilty. A lot of people feel like they shouldn't do it. It's if you want to get Botox or fillers, like enjoy it. You deserve it if you want to. So I want to end with talking about toxins in makeup because, we talk about this a lot, and the makeup industry and the cosmetic industry is very unregulated, especially cosmetic products. So in the European Union, what I think is interesting is that they have banned over 1,600 different chemicals from personal care products. The US, the FDA has blocked 9. So obviously there's a big difference between 9 and 1,600. Some states are actually passing their own laws. The PFAS-Free Beauty Act in California blocks these PFAS chemicals from being in their product. And so there's a number of different websites that you can go to. So again, just like the EWG Skin Deep, you can go to a bunch of different places to figure out what is safe and what's not safe. And again, don't throw it all out, and also figure out like what your comfort level is. So for example, I use the Beauty Counter, makeup, but I really like Maybelline mascara. And so Maybelline's not maybe the safest, but I feel like I'm going to take that risk. And so just figuring out what your level of comfort is going to be. So how do you pick safer products? It's hard to read ingredients. It's hard to know what's in everything. So there's a couple of great resources available. Simplify, Clearia, or Think Dirty. Read the labels. There are no standards, and many things are labeled as pure or natural, but actually are not. And then there are chemicals. This website, Chemicals of Concern through safecosmetics.org, and the EWG Skin Deep. So this is the campaign for safe cosmetics, and they have not only like chemicals to watch out for, but you can search and pick safer products. So, it's a great, again, starting point just to figure out, all right, I'm looking to make some changes, and you don't have to. Again, I think the point of this is just to make you aware, make you empowered, so you can take changes that work best for you. So that's it for me.
All of a sudden turned into Shrek overnight through her TCHP chemotherapy. I experienced severe erythema, redness in my face. I was completely broken out, lost all of my hair. Like, it was just not a fun experience, to say the least. And nobody in my office would touch me with a 10-foot pole. None of the dermatologists, none of the PAs, nobody. They were like, you cannot use anything with vitamin C, active ingredients. And even if I tried, everything just burned the daylights out of my skin. And I was also working during the height of COVID when I was diagnosed. So I had to wear a mask all day, which just, breathing through a mask all day in the medical field, you're just trapping moisture under there. So then bring on an acne breakout. So I was just constantly clogged and irritated 24/7. And the only thing that I could use during my treatment was products from CeraVe, which are very gentle. Only just a gentle moisturizer, a gentle cleanser, and sunscreen. That was it. Go buy Botox, go buy filler, go buy lasers, go buy chemical peels, all of my fun stuff that I'm so used to getting. You just can't do it. And even things that you think that may not be irritating, even something that is quote unquote labeled gentle, may or may not aggravate your skin. And I did a lot of trial and error with what I could use, what didn't. itch or burn, and it took months and months and months. But if you are experiencing the skin related side effects to chemotherapy, the most important things to remember, as Dr. Toplinsky touched on, was you want things that are absolutely gentle. And by gentle, you want to look for things that are soap free, which, seems counterintuitive. You're like, well, what do you mean soap free? How am I going to wash my face? Because soap has surfactants in it, which is what gives it its foaming ability. That can actually strip more moisture out of your skin. So you want to look for more creamier versions and things that contain, again, hyaluronic acid. Hyaluronic acid holds moisture into the skin, but also ceramides and humectants. Ceramides will help to lubricate the layers of the skin, and humectants also will pull and attract more water into the skin and keep your skin hydrated. So those are the most important things. When it comes to sunscreens, as Dr. Toplinsky had mentioned, physical sunscreens are the best. Why is that? Because when you are applying a sunscreen that contains zinc and titanium, when you go out into the sun, that creates a physical blocker to your skin. So the damaging rays of the sun will actually bounce off of your face. Now, you still have to reapply every 2 hours or more if you are sweating or going into the water. But when you look at chemical sunscreens that contain like avobenzone, oxybenzone, all the benzones, the ones, those actually pull the rays of the sun into your skin, which can not only cause hyperpigmentation if you're more prone to that, but these chemicals are not breaking down in your system. They're actually being held onto by your skin cells. So there's data that shows that some of them can last in your body up to a week or more. So it's just safer, just all around, just to look for the zinc and titanium. It doesn't have to be like a specific percentage. You want to make sure they either contain one or the other, and you're at least an SPF 30 to 50. Anything above a 50 is honestly just marketing. It statistically can't be proven that protection stops past like SPF 47. I believe that's the most recent data. So anything above a 50, garbage marketing. But once you're able to slowly, you're out of your chemotherapy regimen, you want to start maybe using more of your active ingredients or go back to your skincare regimen, do it slowly, because you can't go from using nothing and gentle ingredients to just all of a sudden vitamin C, exfoliators, retinol. Oh my God, it is going to hurt like hell. You're going to be in the dermatologist's office with a horrible allergic reaction or just very, very sensitized skin. So the key thing is to just realize that it's very temporary. We have, as thrivers, survivors, and people who have experienced this, really, we have a new definition of beautiful. We are all beautiful, strong women who have gone through so much and can conquer anything after this. So being a little wrinkly temporarily, and it's nice that my Botox is finally kicking in. I can see it on camera. Being a little, maybe you're a little more red, you're a little irritated. There is light at the end of the tunnel. This is temporary. It will resolve. Everybody's skin is different. So resolution to, kind of relieve these things does take a little time. I'm also an esthetician, and I am getting my certification in oncology skincare. So it's, a near and dear thing to my heart. It's actually what kind of brought me to school where I'm sitting now at Parisian Beauty Academy in Hackensack, New Jersey. 12 more days till I graduate. But it's something that we can all get through. Again, very temporary. Don't beat yourself up over this. This is just a blip in the road. And the new normal that you develop and that you find for yourself ends up sometimes being better than the previous version. Like, I know throughout this whole experience, I've come out on the better side. I love my short hair. I actually added more gray into it because I love the punk rock Cruella de Vil look that I've somehow developed after my chemotherapy grow back. So, it's just something we all gotta just hold on. It's over before you know it. There's light at the end of the tunnel, but you guys are surrounded by an amazing support team like Dr. Toplinsky and all of the team members at Valley. You guys, we're all in good hands. So, power to everyone. And for any, future skincare needs, I will always be available to any of the Valley patients who ever have any questions. I actually practice in Hackensack, New Jersey. I'm not too far from the Lookout Pavilion. So anything ever needed by anybody or recommendations needed, Dr. Toplinsky knows where to find me, and you guys always have the hookup. Thank you, Dr. Toplinsky.
And then I'm going to turn it over now to Jillian Rezzo. All right, let me just share my screen here for Jillian.
All right. Hi. Thank you. Thank you, Dr. Toplinsky. Thank you, Joelle. That was awesome. I was taking a whole lot of notes. So listen, I'm going to get to these pictures that are up there in just a second, but I just want to say thank you so much for having me. And actually this week in 2013, I was diagnosed with stage 2B breast cancer, and I am so happy to be here. So thank you to the Valley team. They saved my life, and I'm 9 years out, which is so great. So I just want to say that my point of view is a combination of, yes, I'm a beauty expert, but I'm also a survivor. And it is inevitable that you will go through these physical changes, not only during, but also long after treatment is over. And what I have found is that this can cause us to really continually look back to how things used to be or how we used to look, right? That's a big thing for us. And because used to be doesn't exist anymore. And that's just the facts. The more time you spend chasing that older version, that pre-treatment version of yourself, it creates disappointment. So it's so crucial to see yourself as beautiful. And I know Joelle touched upon this, in whatever moment you are at. And sometimes that does take a little reflection and willingness to have some fun with yourself. So today, I definitely want to give you some tangible tips and some thoughts on really how to approach things maybe out of the box a little bit. And now, while beauty is definitely very individualized, and I wish I could speak to all of you on that level, there are a few key and common threads that are going to really help. And just to tag on to Dr. Toplinsky's what she was talking about, you do the research on the product. I'm going to give you the idea and then you find out what works for you. So what I do want to talk about is what you're seeing in front of you now. This is just a little spattering of some beautiful survivors and fighters. Some are metastatic, some are longer out, some were just fresh out, of these beautiful warriors that I have had the pleasure of painting in my lifetime as a makeup artist. I know a lot of them are from Valley. I've probably had the pleasure of maybe painting in my career 500 to 600 survivors. And I personally think we are just gorgeous wherever we're at. And a reason I wanted these photos up is because some of the tips and tricks that I'm going to talk about, I want to kind of maybe point out to a photo and explain how that applies. So number one, because I have to go through this kind of fast, I want to talk about brows, because that seems to be the bane of everybody's existence. I mean, even whether you had breast cancer or not, brows are tough for people. So if you have no brows or you have very thin brows, I am going to tell you right now that you do not want your brows to look solid. That is so important, unless you are going for a particular kind of harder look. So Carmen is the gal that's bald. She's got the little pearl drop earrings on. If you take a look at her brows, those are completely drawn in. Carmen is metastatic. She's always on chemo. She never has any kind of hair. So what we did with Carmen is what I do with almost everybody. I use micro pencils. Micro pencils are crucial because they really give you a less solid effect on the brow. So always use a feather-like stroke. And I also recommend sometimes mixing two colors. So you can do a black and a dark brown, or a blonde and a taupe, just to get it more dimensional. Now, if you don't have any hair, and it might kind of smear off, or you struggle with that, I always recommend using an eyebrow glue. But the problem with eyebrow glue is that if you don't have hair, the brush is going to wipe off the beautiful work that you just did. So what I recommend is taking a very light brush, like a light stippling eyeshadow brush. Once you get those feather-like strokes in, keep air between them. Take a little bit of the eyeshadow brush, just a little bit of the glue, and very softly dabble it on, and that will kind of seal it into place so it doesn't slide off for you. Also, to make the eyes pop, without lashes and to make the eyes look brighter looking, you want to fill the lash line in, but you want to stay away from hard lines, again, unless you're going for a particular cat-eyed look. So what I always recommend is that you get a black or a dark brown pencil, whatever you're more comfortable with, and then choose a softer eyeshadow color. So, and it can be anything. Just get a bunch like neutral, any kind of brown or gray or anything that's really soft. And then every single person in these photos has this technique at some different level. I want you to take the black or the dark brown pencil. I want you to fill in your eyelash line as much as you can. Like I'm not even wearing mascara right now and you really don't notice it because of the liner and shadow. So you're gonna really get in there, make sure that that black is in that lash line, and then just dip into a little bit of a softer color, a brown, a gray, and I want you to smear. I want you to lightly smear it to create a softer, smoky look. This takes the attention away from the lashes. Like Carmen is not wearing lashes in that photo, and you wouldn't even notice it. So I'm not wearing mascara. So really it's not about the lashes. It's about creating this kind of depth and smokiness to the eye area. That's really important. Now, if you do have lashes and you want to pop the eye a little bit, you can do the same thing, but don't be afraid to try like a deep blue mascara. Deep blue is amazing on every skin tone, every eye color, not an electric, but a deep blue, because that's going to make the whites of the eyes look whiter. It's really going to pop them a bit. And I know that red and plums are very, very popular. I love a good red mascara, but you have to be very careful because they can make you look tired. So if you want to use a red or a plum, this goes for eyeshadow too, you have to use what I call an anchor color. So if you look up to the left, you see the gal who's got, she's kind of biting her lip, right? That's Krista at the top. She's got the curly blonde with the pink streaks. What you're going to see there is that, yes, we did do a plum and we did do a little bit of kind of other, silvery colors, but they're anchored with a dark gray and a black. That anchor separates the whites of the eye. So you're not putting a red or a purple right against the white of the eye, which is what we would do in makeup to make you look tired. So you're separating it. So that's really important. So don't be afraid to use that, but just separate it with an anchor color. Then to move to the skin, depending on your skin tone, you're going to change the colors, but skin color drops, amazing. Best thing you can do for your skin when you're going through treatment or long after. Every single person in these photos, I use them every day. You can get them in bronze, pink, purple, apricot. They're game changers. So depending on your skin tone, you just take a little bit, like I use the bronze. I have this, they don't even make this anymore. This was from a great line. And I just drop a little bit of the bronze into my foundation, a little bit, and then put my foundation on. You do it with pink, you can do it with plum, do it with apricot, and that is going to lift the skin tone. So get some good color drops, that's important. And then because of hot flashes, the makeup does tend to break apart. I mean, I'm closer to 60 and before I had my ice pack because I was dying. I'm like, why am I hot flashing? I don't even have any hormones left, but I feel like it's just part of it. So with hot flashes, you want to hold the makeup, but sometimes looking over powdered is not good. So what I want you to look for is something, they're called, they're clear mattifiers. I use one from Veil Cosmetics. I believe they're vegan. I do not know. But it's it's almost like a wax, and you're just going to press that on over your makeup. It holds everything in place. So the women, like for instance, that you see here, rather than powdering them through this whole photo shoot that we just did this wax when the skin started to separate. So that way it takes away the shine without moving the makeup. Then I also want to say on highlighters, be very careful. Look for a matte highlighter. Sometimes shimmer highlighters, it's too much on the skin. It shows the pores. It's in pictures great, but in person maybe not always as much. So look for a highlighter that has more of a matte. Literally just type in matte highlighter and you'll find it. So what you'll get is a reflection, a beautiful reflection off the skin. Just like the gal with the pink wig is, she's right in the center. She has a matte highlighter. So does Danny next to her in the burgundy dress. So a matte highlighter gives you reflection, but it doesn't give you too much shine. Also, I do want to say that around the eyes is my last tip here, is a very tricky spot. So one of the things that I love to do is, yes, I use, because I'm very dry, so I use my eye cream morning and night. And we tend to overdo concealer because I think when you're in treatment and then even long after, we get a little darker and a little deeper in this area. So instead of overcompensating with too much concealer, get a really nice textured eye cream, like more of a gel type eye cream, but still use your regular one that's going to hydrate you, and mix that with your concealer. Use it with the concealer and then use that around the eye area. And then you can use a tiny little bit of powder to kind of set that in. So that way it's creating less weight. So you're not going to get that lined look around the eye, but you're still going to get the coverage that you want. And I want to talk just very, very quickly about taking a chance and kind of thinking out of the box. This is really important. I want to share with you how important this is to be kind to yourself. I don't care how old you are. I know I've worked with, from a beauty standpoint, with 25-year-old fighters and survivors and 80-year-old survivors and fighters. We all want to look beautiful, but in chasing the past, we kind of lose out on the fun that is right now and taking a chance. So when I went into cancer, just so, to give you my story, I was about 20 pounds thinner naturally. I had jet black hair. My hairline was much lower. I did lose hair. And everything I didn't wear glasses. My vision was still really good. And I kind of loved that Audrey Hepburn vibe. When I was on, tamoxifen for the first 6 months, I probably put on a good 35 pounds, and I couldn't hold that look anymore. And I beat the crap out of myself. I was like, I don't look like myself. I don't look like myself. And then I stopped and I thought, you know what? Okay, you are a fuller person. Yes, you are. And you don't have the hair you did. So I chose Amber Rose. Amber Rose, if you don't know her, you have to look her up. She was my spirit animal. She's amazing, curvy, model with a shaved blonde head. So I took that chance and I shaved my head. Pretty much I've shaved my head ever since. It's much longer now than I've been wearing it. So all I'm saying is have fun and play with it. It's the space that we're in. Try a different color wig. Try a different color hair, try a different makeup style. Look to someone, and we've all been there. Have you ever seen someone and you're like, oh, I love that, but I couldn't do it? Yes, you can. Try it. If you love it, absolutely try it. So just pull some images of things that are opposite that you would normally do that maybe fit a little bit more into how you feel about yourself today rather than constantly looking back. So I hope that helps. I'm going to pass it back over to Dr. Toplinsky and say thank you so much for your time.
Thoughts on Botox while on Xeloda? I know it's a chemo, maybe less worrisome of infection, and I think that's true. So it depends. Are you on Botox are you on Xeloda for a set period of time? In which case I would hold off. If it's for metastatic cancer and you're on it indefinitely and Botox is something that you want to do, I think there is a discussion that we could consider it if your blood counts are good, maybe on your week off from Xeloda, as long as your skin's not super irritated. So I would be definitely open to having that conversation. Wondering if timing of Botox and flu shot can be addressed. As far as I know, there's really no issue with the flu shot and really anything. So, and Joelle is shaking her head here as well. So definitely get.
No, not with the flu shot. There were some studies that there could have been a potential interaction with the COVID vaccine, but I think that's even been debunked, but absolutely no reaction with the flu shot.
Perfect. Okay. While in Kadcyla, can I use retinol facial creams and laser hair removal while Kadcyla? So again, Kadcyla is one of those things where it's not chemotherapy per se, it's anti-HER2 therapy, but it does bind to HER2 positive cells and releases a very potent drug into those cells. So I think if your skin is okay, none of these things are like an absolute. So I think if your skin is okay and you've been on Kadcyla for a couple of weeks, maybe a month or two, and you're like, good, I don't have any irritation, talk to your doctor, but I would be okay with it. Again, if you feel like you need it and it's helpful. Same thing with laser hair removal. Again, if your blood counts aren't too bad. Now, Kadcyla can cause low blood counts and low platelets, so you want to be a little bit careful in that. Hair dyes. I don't know if hair highlighting fall in the same category. So I was actually just looking this up when we got this question. And to be honest, there's not a clear answer for that. I would consider hair highlighting kind of semi-permanent. And so maybe in between semi-permanent and permanent. So I think you probably are safer than a permanent dye, but we don't have a lot of data for that.
I sure did.
I did.
I think the hardest thing for me to personally deal with when I lost was not necessarily like my eyebrows, because it's like, okay, it was my eyelashes, because they started like coming out in chunks, and then they grew back a little bit and then fell out again. Like it was like a secondary fallout that was very bizarre. My eyebrows grew back a little bit. I actually have to draw them in every day. My eyebrows are not microbladed. I learned a trick from Trish McAvoy, the goddess herself, makeup artist. If you have a very thin eyebrows, I don't know if you've heard of this, Jillian, too. If you take mascara primer, the one that's in the white tube, like I think I use the L'Oreal one, and you brush it into your brows and you let it dry. It actually makes it look like you have more hair, and then you can go in and draw with a pencil. So that's actually how I make mine look a little fuller. So that's a little brow trick from me. But yeah, no, I definitely did, and they do come back. It just takes a while.
As a 6-year survivor, I'm timid with applying moisturizer at this point in the treated breast underarm area for concern of causing a recurrence. Is there any issues to be mindful of? I mean, again, we know that it's safe, but you have to be comfortable with it. So if you feel like you feel less anxious or you feel calmer by not doing it, then there's no thing that says that you have to do it. So I think my recommendation always is to do what you're comfortable with and what feels good to you. Some people want to use antiperspirants and other people don't. And I think there's not a right answer. There's things that we definitely say, look, this is not safe, but the deodorants and perspirants are not one of them. Again, unless you're using those spray with the benzene, we don't want those. Okay, lavender has estrogen boosting properties. So the data for this actually comes from very old studies where they noticed boys who were using like lavender lotions and products that their moms were giving them, and they started having a little bit of male breast tissue. And so that kind of came out saying, oh, lavender is estrogenic and we shouldn't use it. And so it is a little bit estrogenic. So I think that it's like one of those things where there's so many other products that I tend to say, like, maybe you use something else unless you really, really like that one. And again, that's something that you're using every day. Some people will disagree with me on this and say that there's no issue with lavender, but that's just my take on it.
I personally don't like Latisse after chemotherapy, only because there's a little concern about it potentially changing the color of your iris. So one of the products that I really, really like is from a company called Revita Lash. The company was actually designed and from a husband of a breast cancer survivor. They have a little more natural based lash and brow serums. They are vegan, no parabens, no garbage in them whatsoever. They're very popular in my office. In fact, my office doesn't even really sell Latisse anymore. So highly recommend. The brand is called Revita Lash. I'll type it in the box.
Thank you. Should estrogen-driven breast cancer survivors and those on aromatase inhibitors avoid collagen peptides for hair and nail growth? So I'm actually going to be posting on this later today or tomorrow. But the bottom line is that collagen kind of gets a bad reputation because in some cancers that have recurred or spread, they found that they have high levels of collagen. But there's no link at all to suggest that taking collagen peptides is linked to higher risk of breast cancer recurrence. And in some cases, collagen actually reduces the risk for breast cancer recurrence, again, in your body, not from a supplementation. So what my thought on it is, it's promoted to help with skin elasticity, mobility, joint pain. If you take it and it works for you, go for it, but don't just take it because it's a fad and your friend is doing it. A lot of times people take it for a month and they feel nothing. Okay, then don't take it, right? Like why add supplements just because they're the thing to do? But if you truly notice a difference, then I think it can be helpful.
Chemotherapy does obviously attack cells that are rapidly dividing. The body cannot, the chemotherapy cannot tell a good cell from a bad cell. It can't distinguish a cancer cell and a healthy skin cell. And it will just destroy everything, which means you're going to lose skin elasticity in some parts of the body. That's totally something that I've personally seen a lot of patients come in and complain of is that breakdown of collagen. So you can use like peptide firming creams. There's also like devices that are non-invasive that can do skin tightening, but that's not something you would be able to really consider until like after chemotherapy for a couple months. But you can do some like just like over-the-counter firming creams that could help. And just a little tidbit on the collagen peptides. Some people, like, I personally like it for joint pain, but like every patient comes into my office and they're like, oh my God, if I like put it in my coffee, am I gonna look like 20 years younger? Is this gonna be like the fountain of youth in a bottle? Like, no, because it's something that each person's body will absorb it different amounts differently. So like Dr. Toplinsky said, like if it works for you and you feel good, like great, but it's not like it's a magic powder in a bottle that's gonna, be like the all fountain of youth. So it's just, we personally don't recommend it because your body you just end up like peeing out more of it than your body actually uses. But hey, if it makes it's a feel good, go for it.
Exactly. Jillian, there's a question about it's up here, but dark under eyes and what you would recommend.
So listen, I'm going to give you a blanket statement. I think that it really depends on the skin tone of the person, right? So, but I'm going to blanket it up till a very deep skin, because once we get into the much deeper skins, then we can flip over a little bit. But in general, use a soft peach first. Use a beautiful, nice, you can get them anywhere, any brand that you choose. I'm a little hesitant to say what I use. I don't know if it's on the safe list, but a lot of brands have very, they'll make like yellow, green, this, that, but you're going to make yourself crazy unless you have someone standing in front of you that can really help you with that. Peach in general is pretty much what I use at almost every shoot, everything I've ever done. So a little bit of peach. And then be careful with, once you do a peach, don't go in too light on the concealer. Try to come in a little more on a skin tone level. So a softer peach, a light peach, not a dark peach, a nice light peach. You can find them just like a peach corrector, a lighter color. Then come in with your concealer a little more on skin tone level, because that peach is going to like put a lot of light behind it. So that's going to help. It's going to help a lot.
Perfect. Thank you. I know there's a lot of questions about certain brands. We're not going to get to those, but I think I would urge you to check out your websites that are there, because, I think the other part of it too is that, we don't all know. I personally don't know a lot of the brands, but I think just asking and doing your research can be helpful. And Joelle and Jillian are much better at the brands. They've put their contact information there. And I'm going to read it out loud because the people who are listening to it later may not see the chat. Actually, so I don't mess it up, Jillian and Joelle, can you just say it out loud? Your Instagram or your best contact information. Just I don't know if the chat will translate later.
Absolutely. So my Instagram is the@skin SKINN therapist, THERAPIST, the.skin therapist, skin with 2 N's. And my email address is my first name, JOELLE, and that's at theskintherapist.com.
Thank you. And Jillian?
So Insta's the best way to reach me. So it's Jillian, you can do lowercase, Jillian with a lower line, a lowercase line, V, lowercase line, and Rezo. And I do want to say on YouTube, Dr. Toplinsky, from my nonprofit that no longer exists, but still, if you go to beautifulself.org, I used to do beauty breaks all the time. So there's probably like 50 different lunchtime or just beauty breaks of me talking about beauty through treatment that you can find on YouTube also.
Thank you. That's going to be really helpful. So thank you all for joining. And then we are doing this monthly, so make sure that you sign up. You do have to sign up for all of the sessions separately because they get a different link for each one. And the one in November is on November 30th at 6 p.m. and that is on joint pain and hot flashes, which is a big topic that we all need to talk about. So thank you all. And I hope that you found this helpful. Have a great night.
Have a great night, everyone.
Good night, everyone.
Bye.